going live.
Good morning, ladies and gentlemen. Welcome to another live session of GETI Talks. My name is Shilpi. I'm the Relationship Manager with the Global Education and Training Institute. My warm greetings on the International Day of Women's Health. And what else can be the best on this day than to talk about women's health in all the way possible? Whether it is talking about their weight loss, whether it is talking about their weaknesses, weakness of health. I'm talking about, like, deficiency of vitamins or calciums, etc., which comes with age. And also about the eyesight, especially teachers who are into education fields. Those people, we have been taking online classes since March, and an entire year has passed. We know that we have been online for more than 12 hours in a day. So I have Dr. Fareeha Khan today. She's from Dubai. She's a medical doctor and an ophthalmologist by profession. She's a homemaker. She's a gym going person, an enthusiast. And looking at her, you wouldn't believe that she is the mother of three children aged 18, 12, and 9. So, Doctor, welcome to our show, and thank you for joining in the Global Education's and Dr. Sunita Gandhi's movement of disruptive education. So, Doctor, I know that you're going to talk about is taking care of our eyes. Of course, eyes are the most beautiful part of a woman's, entire appearance. But about also, what I would like you to focus on is the general well-being of a woman. You know, uh, Encompassing everything, physical health to mental health. So I give this platform to you, Dr. Fareeha. And she has worked for the first few years, and then she also realized that she is a mother as well. So, like any other woman, she has divided her time, and now she is taking full time care of her children. So, Dr. Fareeha, I would like you to introduce a little bit about yourself, and then let's get back to the topic.
Good morning. Happy International Women's Day to all the women who are here with us. First of all, I'd like to thank Global Education Institute for giving me this opportunity to teach, to talk about exercise and diet for healthy eyesight and general well-being of women, how it shapes the mind and the next generation of the students. My talk today is about self-care, the importance of eye checkup and eye care. We as women are primed. Can you change the slide, please? We as women are primed from a very young age to put others before ourselves. It is so deeply ingrained into the making of our fabric that it becomes second nature. So what is self-care? Next slide. Is it a day in the spa or an escape into a vacation? Or is it an outing alone or with a loved one? Shilpi, you can keep changing the slides, okay? The consumer world would like us to believe that it is so, but none of this could help serve the purpose if we are not at peace with ourselves, within ourselves. It can be a means to an end, but not an end in itself. So if I try to define self-care, it can be deliberate, restorative activity to take care of our well-being. Well-being is the balance internally and with our surrounding, and stress is the major threat to it. It can be physical or emotional. Stress is the leading cause of health issues. I'm unable to change the slides. Shilpi, I hope that's going with you. So self-care is not selfish. We are on the 6th slide. It can be stress can be physical or emotional. Stress is the leading cause of health issues. It can be what goes into our bodies consciously or subconsciously, and through what we eat, read, hear, or absorb through our different senses. It affects our immune system and energy levels and our emotional well-being. It can alter the way we see ourselves and the world around us. All that being said, how can we de-stress? Firstly, what we eat. Healthy foods, whether they are vegetarian, non-vegetarian, vegan, or organic, will help our body cope with stress. Foods like coffee, tea, sugars, and processed foods increase the oxidative stress and hence are best avoided or kept to a minimum. Everything we hear or read, advertently or inadvertently, is going to affect our subconscious state. How we deal with the factors around us, especially things that are beyond our control. Consciously close your eyes and take 5 deep breaths and relax your body and also your mind, bringing to focus the sounds within yourselves and forcing shut the noise around you so that you can fine tune and modulate and then choose which sounds you wish to keep and listen to. In other words, meditation. It plays a key factor to de-stress the mind and body. Anything you love to do that gives you peace. For me, it is my exercise and gym routine, my prayers, my plants, spending time with my family. It could be yoga, painting, singing, or even sleeping. Find it and keep it. Find time in your day to do this and reconnect with yourself. The eye is the window to the soul is an old adage I'd like to borrow and bring to your attention what your eyes can reveal about your health to your eye doctor. In fact, sometimes an ophthalmologist will be the first physician to diagnose a medical condition because the first signs will silently show up in the eye. Thus, having your eyes thoroughly examined is more than just getting a prescription for your new glasses and contact lenses. The eye is the only place in the human body where part of the central nervous system can be visible. In fact, when we check the retina and the optic nerve during an eye exam, we are actually looking at extensions of the brain. But there is even more information that can be gleaned about your health during an eye exam, and some of these conditions are discussed here. Heart disease and high blood pressure or hypertension is a very common disease and has manifestations in the eye depending on the severity and duration of the disease. In very severe cases, there are characteristic changes in the eye, including swelling of the optic nerve and bleeding of the retina. Atherosclerosis is a disease in which plaques are formed in the arteries. This is a buildup of fatty deposit or cholesterol in the walls of the arteries. A piece of this may break and lodge in the small arteries and sometimes in the veins, causing severe vision loss. Sometimes the patient may have no symptoms, but the doctor may notice changes and send you to the physician for further investigation, as this may be the first sign of a major eye problem. Diabetes. It is the leading cause of blindness in adults. Diabetes can have an impact on many parts of the eye, but most common is the diabetic retinopathy, in which blood vessels of the eye can swell and leak, and there can be growth of abnormal new blood vessels. Sometimes the growth can be close to the drainage system and can cause severe pressure changes that is called as glaucoma. The best way to prevent this is to optimize blood sugar and blood pressure control. Thyroid diseases. Whether it's hypothyroidism or hyperthyroidism, one can develop eye changes. It can vary in severity and can involve one or both eyes. Some signs are bulging of the eyes. Sometimes signs are bulging of the eyes, eyelid changes, double vision due to involvement of the eye muscles, dry eyes from exposure of cornea, and sometimes compression of the optic nerves. The ophthalmologist has to work with your endocrinologist to manage the eye care. Rheumatoid arthritis. Many autoimmune diseases affect the eye, and rheumatoid arthritis is the most common. It causes dry eye, which can vary in severity and be related to insufficient tears. Also, there may be inflammation of other parts of the eyes. There may be persistent redness with active inflammatory arthritis and needs constant care and support by your ophthalmologist. Also, part of our self-care is taking care of our eyes at home. Some of the things that we can do are as we spend a lot of time on the computers and screens, we can restrict our screen times, not only for our children, but also for ourselves. Also follow the simple 20-20-20 rule. If you can go back to the previous slide, Shilpi. The 20-20 rule, it is after every 20 minutes of computer time, Try to get up and move around, or at least look away for 20 seconds at something that is 20 feet away. Rubbing eyes it can cause infection or even damage the cornea. This can be because your hands are very dirty. Sometimes you have not washed your hands, and sometimes extreme vigorous rubbing can be a predisposing factor for corneal diseases. When going out in the sun, try wearing sunglasses as it protects the eyes from harmful UV rays of the sun. Next slide, please. Avoid reading in low light and texting or reading while walking and in moving vehicles. Avoid using screens or computers in the dark and just before bedtime. Amongst the good habits for the eyes, please change the screen. Washing eyes regularly and periodically with cool water, eye exercises, which are movements you keep looking up and down. So you're going to the extreme movements of your eyes. This will help relax your eye muscles from the constant staring at the screen, and it helps with proper vision for distance and near vision. Also palming, which is a very good exercise. You can rub your hands till they are warm and then just cover your eyes, which gives relaxation to the muscles of the eyes. And you can hold a pencil in front of your eyes and look away and focus on the pencil. So this will help with the distance and near vision, where we are constantly looking at the screen. Next screen, please. Also eating antioxidant-rich foods, which are fruits and vegetables, and omega-rich foods, which are like walnuts, flax, and chia seeds. Regular eye examinations, as we just talked about, looking at greenery and going for early morning walks in the parks or in the beach. Eye vitamins and supplements, especially for those who have predisposing factors, who have been diagnosed with different defects that might have been found in the eye, and who are not regular with their diets. A very important thing is to quit alcohol and smoking, which can have very detrimental effects to the eye. In conclusion, I thank you for your kind attention, and I conclude the talk with 3 important take-home messages. Take care of yourself as a self-priority. Book an appointment with an ophthalmologist to have a baseline exam so you can look back and say everything was okay in 2021. Take care of your eyes, as it is a window through which you see the rest of the world. Thank you very much. And we open the floor to any questions that you might have.
Thank you, Dr. Fareeha. I think in a very short time, you have been able to give the important aspects of taking care of the eyes. So, as you were also talking about the general well-being, can you give some little tips about how, when we are working online and we are constantly in front of the, computer screen, so what are the little things that we can keep doing, because we cannot avoid it if we are working, and this is how the world is today. Half of the time we are on Zoom calls or we are online somewhere. So what is the way that we can give this kind of rest to our eyes? And what happens, we see redness in the eyes after a long duration sitting in front of the screen. So what are the ways we can avoid it, and we can take care of our eyes?
Yes, you're very right, Shilpi. With this present day, we are constantly on the computers, and very honestly, some of this work is unavoidable and much of it is definitely avoidable. So as I mentioned, when we put screen time restrictions for our children, we need to monitor our own screen times first. So practice what you preach is the first thing I would say. So definitely, when the moment we get off our Zoom call or our important meetings and everything, we are constantly scrolling on our phones. So that is one restriction we can definitely control. As far as the eyes are concerned, a very important thing is the 20-20-20 term that has been coined, and it's very easy to remember. So after every 20 minutes of being on the screen, you make a conscious effort. If needed, for initially, you set up a timer. And every 20 minutes, you take that necessary break. And the best thing for your whole body is to get up, walk around, just do 10 jumping jacks, or just do 2, 5, 10 push-ups, whatever you can do. Because your whole body is getting stiff. We are focusing on the eyes 100%, but our whole body sitting in that posture is just tired and sick of that constant in one position. So get up, move around for a bit, get a glass of water, come back, and the thing is, after 20 minutes of work, look away for 20 feet and take a 20-second break to your eyes. So that's the 20-20-20 rule. And the best thing is to maybe look outside your window, look at the greenery, because that green color being in the middle of the visual spectrum has a very calming effect on the eyes. So always that is the most relaxing color for the eyes. So
And
looking out, relaxing is the best thing.
yeah. And the last, but not the least, the very important question these days, like cosmetics, girls are into using it a lot these days. So, would you like to give something like how hazardous are they, or how to use them? Sometimes we go off to sleep with it. So, would you like to give some suggestions to the, especially the younger generation these days? They use all.
I think,
Yeah.
yes, I agree, but I think all of us are guilty of it. And I think it's a small guilty pleasure that can be quite harmless if we use it wisely. So contact lenses are also very much in that they were not maybe 20 years ago. Even not necessary prescription eye lenses. People are going for colored contact lenses
Yeah.
because it's just so easy to change your appearance, and it's a very effective way. So if used wisely and in the proper way, if you're using contact lenses, make sure you're washing your hands before using them. And if you have the slightest redness or any sign of infection, then don't use your contact lenses. Or if you have been wearing them and you feel that during that time you had the infection or whatever, please make sure you're discarding them and don't use them beyond the prescribed period that they are ascribed for. As far as
So,
the makeup,
wearing
eye
them
makeup is
for
concerned,
long hours, wearing them for long hours, is it okay? Or you can, switch between contact lenses and the, eyeglasses.
yes, there are some now lenses have advanced a lot. So before, when the lenses could be used only for 6 hours, now they have 24-hour contact lenses, which have better oxygen permeability for the eyes. So they are more comfortable. You can wear them for an extended period. But usually those lenses are disposable and usable for only for a week. So after a week, when I say don't use them beyond the prescribed period, that's what I mean. So जो colored lenses होते हैं, जो हम थोड़े time के लिए use करते हैं, तो beyond the prescribed period, उसे जबरदस्ती हम पहन रहे हैं, तो definitely they're going to have damage on the eyes. As far as the eye makeup is concerned, there is no issues because it's going around the eyes. Just make sure that if you feel that you are allergic to any one of the ingredients in the eye makeup, then avoid using that, and make sure you wash your eyes and clean properly before you go to sleep, because any remnants of the eye makeup on the eyes is definitely going to affect them, cause allergies in the future. And
There
once
is
you've
one
recovered from that, you
question.
can
Yeah, there is one question from our audience. She says, "How much do anti-glare glasses help? As there is an increase in unavoidable screen time." So yes, we are using anti-glare glasses these days. So that is what she wants to ask. How much is it helpful to us?
Definitely its advantages, because the blue light that's constantly exposed to our eyes causes dryness of the cornea. And another important thing that we need to remember is the blink rate. So when we are constantly staring at the screen, our blink rate is much lesser. So consciously blinking your eyes, that's the time when we are asked to look away, or even when we are looking at the screen, be conscious that you're going to blink your eyes, because normally blinking is an unconscious natural phenomena that goes by itself. But when we're so focused on reading something, our blink rate is much lesser than the normal. Normally we would blink 12 to 15 times a minute, and somebody who's reading a book or using the computer might blink only 6 times a minute. Now, while you're reading a book, you're not facing the glare of the book, whereas in the computer you are. Another important thing is positioning the computer so that it is at eye level. You're not straining up or looking down where you're even causing strain to your neck. And if there is any lights close to the computer, it should not be falling on the screen, so that glare is not coming. That's an additional glare. The blue filters, there are the screens that you can put on the computer which decrease the glare, and also definitely the blue glasses that are given
Yeah.
as the prescription glasses, they're also helpful in protecting your eyes.
And talking about a diet, what kind of food would help, in keeping the eyes healthy and giving, like the ladies, as they are concerned, giving a glow to the eye and, that charming thing. So,
Uh,
what is the diet that they can intake?
what's happening with our eyes is there is oxidative stress.
Yeah.
Because of the stress, because our rods and cones in the retina, in the जो पीछे आँख का पर्दा बोलते हैं, तो उस पे
Mhm.
constantly the rays of the sun that are being processed over there, which help in our vision, they are there's free oxygen radicals that are released over there. So those need to be neutralized. So any of the oxidative foods that are good for our diet, the antioxidant rich foods that I mentioned, they are mainly the fresh fruits and vegetables. And as we are told from a very young age, all yellow and orange vegetables are good for the eyes. So your papaya and your carrots, definitely your beetroots, and all the kales and spinach, all those things that are harder to eat
Yes.
are the ones that are going to benefit your eyes. The amla, the vitamin C rich foods are also very healthy for the eyes. And another thing with the recent studies are omega 3 rich foods. These are mainly walnuts, chia seeds, and flax seeds. So it's that with a very simple attempt, you can easily include these in your diet.
Okay. Thank you so much, Dr. Faria, for taking out time and being with us. I know all the way from Dubai. So, once again, I wish all my ladies a very, very happy International Day of Women's Health. And I hope all the tips that given by the doctor, you're going to take care. She hasn't mentioned pani puris and all in that. So, she's
Yeah,
mentioned.
that's not. Our desi foods are more acceptable to the body. And
Yes.
actually, as the research is going on, everything that is so ingrained in our desi foods, whether it's turmeric or ginger or cinnamon,
Yes.
all these researchers are now realizing that they have anti-cancer properties and antioxidant properties. And for us, we don't have to make an extra attempt to include them. ये
Yes.
already हमारी खट्टी चटनी में होते हैं. So just an excuse to have
Yes.
more.
Yes. Yes. That's right. That's right. So, thank you so much once again, Doctor, and we look forward to you for another session in the coming future over a much more interesting topic regarding women's health. So, take care, everybody, and glow with beauty and with intellect. So, thank you once again, and have a good day, ma'am.
Thank you very much, Shilpi, and a wonderful Women's Day for all of you. Please keep self-care as a priority. We
Exactly.
prioritize everything and everybody and put ourselves at the bottom of everything when we don't have any energy left. So make
Yes.
sure you're taking care of yourself because nobody else is going to do it for you. And you cannot give from a cup that is empty. So keep your cup
Very
full of
well.
love and of self-care and of happiness and peace so that you can pass these on to the people around you.
Thank you so much, Doctor. That was such a nice ending that, if we cannot take care of ourselves, it's so hard to take care of anybody else, and we should prioritize our health. So, once again, thank you so much. And to my viewers, stay tuned in for another session coming up in the evening with Dr. Madhupriya Darshini.
Thank you.
Thank you.
Bye-bye.
Bye.